Welcome, everyone. We're so pleased to have you here for our discussion of the Aging Initiative's pilot project grants. My name is Elise Adams, and I'm a professor at Stanford School of Medicine. I'm joined today by Dr. Liz Bayless, who is at the Kaiser Permanente Institute for Health Research in Colorado, as well as a professor at the University of Colorado School of Medicine. Welcome. Next slide, please. So today we're also joined by two outstanding patient and caregiver advisors to the Aging Initiative. Carol Schulte is an aging advisor from New Jersey, and Rosie Bartel is also a caregiver and advisor from Wisconsin, and both of them have been actively engaged in building the Aging Initiative and building out our advisory council, and they're also here to provide you with advice today about the pilot grants. So welcome, Rosie and Carol. Next slide, please. First, I'm going to talk a little bit about what the pilot grants are. We're going to go through a number of relatively dry slides around the administrative components of the pilot projects. Liz is then going to talk a little bit about some new initiatives that we have going on, and then Rosie and Carol will also provide advice. At the end, you'll get a chance to ask questions. If questions come to you during the presentation today, please just put them in the chat or raise your hand, and we'll get to you when we come to the discussion section. We're happy to answer questions at that time. So the pilot projects are one-year pilot projects. They must be focused on multiple chronic conditions and support activities that will increase the likelihood of future funding. We're going to be funding up to 3 grants, not exceeding $40,000. We welcome all types of research projects as long as there's a focus on multiple chronic conditions. And I should also say that they're feasible to be conducted with that $40,000 and in that 1-year time frame. This is really to get some ideas generating, get some preliminary data to then further your work. Specific examples of research topics can be found in a previously published paper from Liz and others. And that's noted here, and it's also in the materials that you can find online. Next slide, please. So we also have a new priority area for funding this cycle, and it is a collaboration with the U.S. Deprescribing Research Network, or USDEN. We will all together focus on deprescribing among older adults with multiple chronic conditions. Proposals responding to this priority area will undergo a joint review by us and USDEN, and the applicants may apply to both programs. However, they cannot receive funding from both programs, so keep that in mind. In the submission form, you'll be asked to indicate whether or not you're actually applying to this joint initiative. Next slide, please. So I'm not going to read the full text here, but basically multiple chronic conditions are sort of permeate among our older adult populations. In particular, having more than one chronic condition is probably the most likely chronic condition that people have. And we know a lot about the fact that interventions are therefore need to consider the multifaceted and complex nature of people with multiple chronic conditions. It's not enough in these pilot awards to simply describe how many chronic conditions people have or who has such chronic conditions. Really what we're looking for is to understand the specific aspects of care and of outcomes that relate to medical complexity that comes from having multiple chronic conditions. And that paper that I just referenced a moment ago really explains some of that underlying logic around why we focus on multiple chronic conditions and why it does require a different lens to look at research related to older adults. Next slide, please. So the Deprescribing Network is also focused on older adults, but not only older adults, and really thinks about deprescribing. The idea that we can actually have polypharmacy, which can actually contribute to adverse outcomes among older adults, simply because we don't think about how many medications they're already taking and how those medications may be either interacting with one another and or creating functional issues for individuals that may not be necessary based on the need of the medicine. So it's really the sort of the science of understanding does the use of multiple medications affect these individuals? And then how do we go through the process of figuring out how and when to remove medications when they're no longer serving the needs of people who receive them? And you can learn more about deprescribing by visiting the Deprescribing Network's website. Next slide, please. So there are a number of resources that we have available for pilot awardees in both of these groups, in the Aging Initiative as well as in USDEN. We have general support in the form of just sort of administrative core, guidance, and information. We also have something called the Grill Library in the Aging Initiative, which is a wonderful, wonderful asset. It really has a number of different metrics that are used among older adults and thinking about people with multiple chronic conditions, and it's there for use. We also had a lot of stakeholder engagement in both initiatives. Two of the individuals who will be speaking in a moment are part of our Patient and Caregiver Council, our Advisory Council, and USDEN also has stakeholders and stakeholder engaged leaders in their cores. We also have webinars in both the Aging Initiative and the USDEN, and people who are applicants to this application are welcome to attend those webinars. We really encourage you to attend those webinars. And for those who actually are awarded, we are going to encourage you to present in the webinars as well. Finally, we also offer consultation. We are so proud to announce that our Patient and Caregiver Advisory Council members have signed on to be advisors to people who are working on pilot grants. They are expert advisors. They've done this for numerous scientists and provide excellent advice, particularly around engagement of older adults in research. And so they're there to help and to advise. And then the USDEN also has consulting services from a research expert in Deprescribing. Next slide, please. For the letter of intent, we do have a letter of intent due November 12th. The reason for the letter of intent is really to give us an idea of what you're thinking about for your project and whether or not it fits the requirements of the RFA. We don't want people to fulfill a full application before they know whether or not their actual project idea fits this particular initiative. So that's the reason for the letter of intent. And really all that's required are sort of brief specific aims, just one page, and a bio sketch. The LOI review criteria are here. You can also find them on the website. But basically, we're looking for, does it fit the RFA? Is it focused on people with multiple chronic conditions? And what's the likelihood that the proposed study will be completed in 1 year? So there's that feasibility question, as well as whether or not it's likely to lead to a future research. For those who were selected to move on in the process, you'll be notified sometime in mid-December that you can move on, and full applications will be due for those individuals on February 25th of next year. Next slide, please. In terms of application requirements, the principal investigator must be affiliated with either the Pepper Centers or the Healthcare Systems Research Network site, or be an investigator who's formally a scholar in our Scholars Program or the USDEN Junior Investigator Intensive Program. The full specification of the study team is not required in the letter of intent. That's intentional because we were hoping for increased collaboration across groups and across sites. So if you have questions about or desire to be linked to other researchers, please do note that in your letter of intent. Each study team is encouraged to have a Pepper Center Healthcare Systems Research Investigator or Junior Investigator on the team. While it's not a requirement, we really do encourage this because we really want to encourage, again, collaboration across different sites. Early career investigators may be principal investigators. They don't have to be, but they very well may be principal investigators. We are defining early stage investigators as those who have not received a major grant from NIH, HRQ, or BCORI or equivalent. Those who have career development awards or planning career development awards are welcome to apply. Approval from the IRB at your own institution will be required before the funds can be released. So please keep that in mind as you're working up your letters of intent and your proposals, that you should really be submitting your IRB documents at the same time so that we could speed that process of you actually getting the funds if you're selected. Next slide, please. But now I'm going to hand it over to Liz to talk a little bit about the full submission components. Thank you, Liz.
Hi, everybody, and thanks, Elise. Can you hear me okay?
Yes.
Okay, yes. Great. Chris, I want to, Chris and Ivan, I'm guessing that these slides are going to be available so that people can refer to them if needed, because some of these slides are sort of nuts and bolts about how to put together the application. You can see here that it's a standard format and includes the pieces that you see. It's a 6-page application, separate from, including the aims page, looks like, and then includes bio sketches and whatnot. The total direct and indirect cost is included in the 40,000. So that's an important thing to keep in mind depending on your institution's indirect rate. Go ahead to the next slide. Here are some of the review criteria that'll be considered by our review panel at the Aging Initiative. Obviously, the relevance to older adults with multiple chronic conditions and or their caregivers who are part of their community. Leveraging the data available to the Pepper Centers and or the HCSRN, methodological rigor and validity of the findings, the likelihood that the findings will be useful going forward. Feasibility, as Elise mentioned a couple of times, and the likelihood that the project with either positive or negative findings would lead to learnings that support future submissions. Note at the bottom that they're going to be reviewed by both scientific and patient caregiver advisor reviewers to ensure the relevance of the proposals and the findings to all stakeholders. Go ahead to the next slide. Looks like I will hold off and hand off the stakeholder review criteria right now.
Hi, I'm Rosie Bartell, and I'm one of the stakeholders, and I'm a patient who has dealt with multiple chronic conditions due to the fact that 12 years ago, I developed a MRSA staph infection after a knee replacement. And that basically, before that, I was a relatively healthy person. But because of that, I've developed multiple chronic situations. One of the things that we are able to offer during this time is the fact that we can tell you about how chronic conditions impact the lives of patients and families, and to what extent that has either positively or negatively impacted the quality of life of older adults dealing with multiple chronic conditions. Our group has been very, I think we've been together about 2 years, but we've been very supportive of the scholars, be it whatever scholars that we've been working with. We're willing to help you look at your papers, meet with you, help you in any which way we can. It's been a real honor to be part of this program, because we've been able to use our lived experience to help you look at how to move forward in your work as scholars and investigators. I do a lot of work with researchers in some other fields, and I just worked on curriculum with the American College of Physicians on pain management and the de-escalating of opioid use. So, that's an area that's very important to me, because as I dealt with a total of more than 58 surgeries during this time and became an amputee and deal with phantom pain every day, the use of opioids could have become a huge problem for me. So my experience of not becoming attached to opioids has become very valuable as I work with different groups. I'm going to pass it off to my partner in crime, Carol, and she'll share a little bit more with you about how we as patient advisors can help you, but open to lots of questions and hope we can help you. I'll tell you, plain language and that plain language summary is key to part of what you do when you write these grants.
Rosie, the aim here is to create patient-focused research, and that means talking to the patients. And we, of course, I am one also. I have had Parkinson's disease for 25 years, and I live with a husband who's had diabetes for 20 years. So I know all the ins and outs, ups and downs of anything I can help with as far as multiple chronic conditions. But we know that you sometimes, especially with prescribing projects or LOLs, that you probably are going to get very technical in some areas and not directly engage the patients and not directly engage the patients and the caregivers. But you do have to correlate it back to how to address within your application, how that could practically translate to better care and quality of life. I mean, I do realize that there are many, many ways you could go. So if anybody needs any help, I mean, many, many ways you could go with impacting the quality of life for people with multiple chronic conditions. All you really, if you're probably concentrating on one chronic condition, then you've got to translate it back to how and speak to patients and caregivers about what they want to see happen. I will be also happy, as Rosie said, to help anybody, work with anybody, communicate with anybody. I have gone to 3 different projects with 3 different pharmaceutical companies to give them advice on products they were developing. And I'm available at any time. I'll turn it back to, I guess it is Elizabeth.
Great. Thank you. Thank you both so much. And here are some, so getting a little echo, so go ahead. There we go. That sounds good. You guys can see the full timeline here that marches out the LOI date next month in November. Full applications due after invitation by the end of February. We will all get you announcements about awards as promptly as possible in early April. And then assuming the IRB approval is teed up the way Elise mentioned, the start date would be early mid-June. The application has a link there that can be accessed. So go ahead to the next slide. Oh, more information, more links for everybody to access as needed. You can learn a lot about the Aging Initiative on the website for that. The USDEN collaboration, of which I am also a part, has a very informative website that you can access there. I'm happy to entertain questions about the interactions between those 2 networks, if that's helpful to anybody who's considering trying to sort of split the difference between in the deprescribing area. I've done some work in that area myself, and I'm excited that these aging and USDEN networks are both trying to advance this really important NIA agenda. And then you can see on the bottom, other inquiries about logistics can go to Ivan at that address. I don't know if there's another slide, Ivan or Chris, after this, or whether that wraps it up.
I think that wraps it up. Now it's just questions for anyone.
Okay, great, thanks.
Thanks so much. So I think we're open for questions. One other thing that I would say, and Ivan or Chris, correct me if this is wrong, but I believe the Deprescribing Network will be having a similar webinar next Thursday about their pilot awards. So just keep that in mind if you're interested in going for this joint effort, that you might want to go ahead and join their webinar as well next week. You will be getting, someone's asking for the slides and links and everything. I believe all of those will go out to the attendees. Is that correct, Chris?
Yes, and everything will be posted on our website, Aging